All right, we'll do 25 minutes and then on lab. Yeah, that's what I said last time is we'll do a little bit of lecture and then lab in class. So that's how we're going forward. Do I need to like separate y'all? Like what's going on?
I'm excited.
Okay.
It's just like, why am I here? What?
All right. Back to the skull, doing spine. And okay. All right, here we go. The vertebral column. So we did briefly go over spinal curvatures. We went over the number of vertebrae in each section of the spine. A little bit of review, right? We have 7 cervical vertebrae, eating breakfast at 7 in the morning, 12 thoracic vertebrae, eating lunch at noon, and dinner at 5. If we see on this left-hand side here, they've nicely numbered them for us. So here are 7 cervical vertebrae, our 12 thoracic vertebrae, and our 5 lumbar vertebrae. And in between all of our vertebrae, we also have these intervertebral discs. So these shock absorbers that go between the bodies of each of the vertebrae. Having these joints between, having all of these spinous processes, having all of these vertebrae allows us to have mobility in our spine, flex forward, extend backwards, bend to one side and the other side, and allows us also to rotate. We also have fused vertebrae, the sacrum and the coccyx. Sacrum and the coccyx. Sacrum is part of the, you can consider it part of the hips and pelvis to an extent, because it is helps make something called the pelvic outlet and inlet. So if you think of the large hole in the middle, essentially, of your pelvis, where kind of all your internal organs sit in your pelvis, it makes up that brim, that pelvic brim, as well. But we'll get to that when we get into the lower extremity. Okay. And with our spine, you can also have excessive curvatures or abnormal curvatures. So we can have scoliosis. Scoliosis is when we have a lateral curvature in the spine. So you can see in this X-ray, this radiograph right here, that spine has a lateral curvature, whereas normal spine should not have a medial or lateral shouldn't have a lateral curvature, excuse me. You can also have kyphosis, so an excessive kyphotic curve, typically found in the cervical spine or thoracic spine. You'll have, particularly in the elderly, right? You might see those older people bent over a lot more, and so you have to get a lot more extension of your neck in order to see straight. So you know, throw him under the bus. Coach Mike, our swimming coach, he goes quite forward, and in order for him to have see straight, he has to have a little bit more head extension. I'm sure if you can see that in many other people. And then excessive lordotic curve, you're going to see that excessive curvature in the lumbar spine right there. This is particularly present in pregnant persons because you're carrying a large mass of weight that is not normally there, and so it puts excess pressure on your spinal column. You can also see this in patients who have excessive weight held in their belly. So that is a pregnant person, yes. How does that have to do with the curvatures of the spine? You're putting excessive, so there's, in a pregnant person, right, you have more than normal weight here in this belly region, right here, right? And so when we have more than normal weight, our body isn't used to that. And so you can have an excessive lordotic curve, because now you have to kind of compensate for that weight in order for you to maintain an upright posture. And so that can cause excess pain.
What could cause
Stenosis.
stenosis? No, I know
It can be from injury. It can be from
not even bad posture.
yeah, can. Put me on the spot. I don't have a lot of patients that present with stenosis. So like, it's not something I see regularly. So it's not something that I know off the top of my head. I will get back to you about that. I'll make a note here. Stenosis. All right. All right. Abnormal curvatures. So now let's talk about a generic vertebrae. This is schematic of one, and kind of the general features that you will find on a vertebra. So first we have this big area in here. Roz, you want to guess what this area is? Yes, the vertebral body. So this structure on the vertebra is going to be the main area where we have weight, where there's going to be compression. You can see in lumbar vertebrae, the body is a lot larger than, say, in the cervical vertebrae, because it has to hold more weight. And so depending on which vertebrae it is or where it is in the spinal column will kind of determine its size. All right. And then we have, so this structure back here, and you can see it picking up back there. That, Chloe, what do you think that might be called? This one's a hard one. Here, I'm going to rephrase this question. I'm going to ask a different question. This, so kind of this whole, let's make this a bit wider. This whole structure back here where this kind of U that I'm making, what might that be called?
The whole structure.
Yeah, kind of the whole big thing.
Vertebral arch.
Yep, so that's the vertebral arch. You can see kind of how it makes it's arched, quote unquote. It has, you know, one what I'll call foot on each side of the vertebral body. So that is called the vertebral arch. Let's make this smaller. Vertebral arch. We'll get to that. So then the vertebral arch has two different parts. It has the pedicle and has the lamina. So the lamina, so the pedicle is the red highlighted stuff. And then the lamina is this structure here. And so you have two lamina, or you can consider it one. That's the lamina. Yeah, so it's past these other structures that we're going to talk about in a moment, and it kind of makes the way that I think about the lamina is. Anyone know about laminar flow of water? No. Okay. So when you draw an arch in, when I think about an arch, when I think about an arch, I think of probably the one arch that comes to mind is the St. Louis Gateway Arch, right? That big metal arch that they have in St. Louis. The lamina, I think of its posterior. So here, let me label this. This is going to be anterior, and this is going to be posterior. Always, the lamina is kind of the structure on the vertebra.
Which part is towards like your back, and then which part's towards your like stomach of the vertebra?
So the anterior portion is towards your face. Posterior portion is towards your back. Right? Directional terms, anterior and posterior. So the body is in the anterior portion, and the other structures are in the posterior portion, which leads me into something that we can palpate on our spine is the spinous process. So let me get back to the lamina. The way that I think about the lamina, it's the arched portion, it's posterior, and it's kind of the biggest arched portion on the vertebra, whereas the pedicle is kind of in between some structures. So the pedicle is in between this spinous process, and the pedicle, excuse me, is in between this other structure that's sticking out transversely, or it's called the transverse process. So the pedicle is between the transverse process and the body, whereas the lamina is typically between the transverse process and the spinous process. So if we draw a spinous process from a top-down view, we have, so we'll have the body here, and we have the transverse processes, and we have lamina. So this is body, lamina, and we need these ones. So these red ones right here are the these are facets. So we have, or excuse me, processes, articular processes. So in order for our spine to move, it needs to articulate with other vertebra. So we have the superior articular process. And the inferior articular process. So the superior articular process is going to articulate with or form a joint with the vertebra above, and the inferior articular process is going to articulate with the vertebra below. So let's say on let's say this spinal segment is L3. So if this is L3, this superior articular process is going to articulate with L2, and the inferior one is going to articulate with L4, right? So that's 3. Kayla.
Are they structurally like the same though? Or is there a difference between?
Is there a difference between the two articular processes?
Like how does the which one connect one?
So the superior articular process is going to articulate with or form a joint with
Yeah.
the vertebra above.
Is that on both sides though, or is it just?
Yes, it's on both sides. So you can see, so it's superior articular process here. We'll highlight.
The processes are both within the one structure.
So it's here and here. So there's that superior articular process. And then the inferior one is over here, and you can see it kind of peeking out right over there. Isabel. All right. So, right, if we let's bring over this whole skeleton.
Yeah. So.
If you grab a vertebra, geez, can't talk. If you grab a vertebrae or two, you can see, if you come up here and look at these, the superior articular processes right here is articulating with the inferior articular process of the spinous process below. So you can see there's that superior articulating process. Here's that inferior articulating process on the spinous process below. And so these processes are sometimes very common we can break these. So we can break the pedicle is quite common to break when in athletics. And these articulating processes can also be sites of irritation and inflammation. When you have overuse injuries, so particularly in in blinds, or not in blinds, in diverse, extending and flexing all the time. Extending and flexing and extending all the time can have consequences, especially if someone is, or an athlete is doing it too much. That's a bone injury. Yes, so if we break the pedicle or we break part of the lamina, that's gonna be a bone injury. Yes, between two vertebral bodies.
And then is there a way to describe the top of the
Is there a way to describe the top of the vertebral body versus the bottom? For this class, you don't need to know. I'm sure if you go into medical school, or if you go, we didn't even cover it when I was in grad school. But if, what's up?
You allowed to go lift if you're in here
No,
or not?
no.
Okay.
I'm sure that, if you get into more detailed anatomy, they will talk about it. It'll probably be something like superior articulating body, and inferior, something along those lines. But for our purposes in this class, for most of what you need to know, it's just vertebral body. You can pretty easily distinguish the top and the bottom because of where the superior and inferior articulating facets are, because they kind of direct you to what orientation the spinous process or the vertebrous vertebrae should be. I don't think you'll get into a situation where you need to label the different sides of the vertebral body. Any other questions about this generic one?
On these models,
Mm-hmm.
so these are the superior processes.
Superior articulating facets, yeah. Superior articulating process, yeah.
And these are the transverse. Now what are this?
Yep.
Is that part of?
So this one is just a generic vertebrae. We'll go over specifics of the cervical and thoracic and lumbar spine momentarily. So hold on to it for a sec. We got 2 minutes left. Here's a nicely labeled one if you want that. So this is again another illustration of a typical vertebral body. In this one, you can see where the spinal cord runs through in the vertebral foramen. Vertebral foramen. Superior articulating process. And you can also see, particularly on thoracic vertebrae, you're going to have a facet for the ribs. So you can see on the skeleton right here how the ribs are attached to the spinous processes. So there needs to be some place for them to attach to. We can also see that intervertebral disc, the transverse process, the spinous process, the body, pedicle, lamina, facet for the head of the rib, superior articulating process, inferior articulating process, and spinous process. These vertebrae on the right-hand side appear to be more thoracic vertebrae. Yes, just a different view. All right. last thing we'll go over, intervertebral discs. So there's a couple of different parts to the intervertebral discs. So we have, we'll label once again. So this structure here is, Kimmy, what did I just circle in blue? Body. And then we have this structure here between the vertebrae. We have another foramen. Michaela, you want to take a stab at what might that hole be, or that foramen might be called? It's between vertebrae. Yep, the intervertebral foramen. Oh gosh, that's too long. And then we have essentially two parts to the intervertebral disc. So we have this outer layer. Let's highlight here. This outer layer here. Called the annulus fibrosus. A-N-U-L-U-S. And then inside we have something called the nucleus pulposus. And so these two parts of the disc serve different purposes. The annulus fibrosus, it's more fibrous, more a little bit more cartilaginous, a little bit stronger. And then in the center, it's more gel-like for that nucleus pulposus. It's that shock absorber, right? So we don't want a structure, Kayla. So we don't want something, right, that's just real hard, real made up of all fibrocartilage. If we had that, it certainly would be, we would probably have less people with, we might have less people with disc problems, but it would come at a cost of having more forces transmitted all the way through your spine, and so all of your vertebrae would have to be bigger. And if it was too squishy, too much nucleus pulposus, too much jelly, too jelly, the disc would have a hard time staying together, and we would have an absolute ton of people with disc problems. And so this kind of gives us that balance where we have a more fibrous, more stronger kind of outer ring, and that softer inner ring to kind of give us the best of both worlds. What was your question, Kayla?
Are we gonna learn about like the nervous system and later? Like,
Yes, next semester, towards the end of next semester, yeah. Nervous system is quite complex. All right, armed with new information on the vertebrae, I want you to spend some time with the vertebrae and see if you can pick up on what structures are what in the vertebrae.